This presentation has been prepared by the Voluntary Assisted Dying Act Implementation Project Team in the WA Department of Health. It is aimed at providers of health care and related care services, such as aged residential care. Providers may be individual clinicians and healthcare providers, or it may be organisations and agencies that provide healthcare or related care services. It is intended to provide basic information relating to the legislation in Western Australia and awareness of the Department of Health preparations for implementation of the legislation. This presentation will cover the following main topics: background to the development and enactment of voluntary assisted dying legislation in Western Australia, a basic understanding of key details of the Voluntary Assisted Dying Act 2019, an overview of the implementation project, and details on how you can keep informed about the progress of implementation. In August 2017, the Parliament of Western Australia convened a Joint Select Committee on End-of-Life Choices. The committee undertook an inquiry into the need for laws in Western Australia to allow citizens to make informed decisions regarding their own end-of-life choices. In August 2018, the committee handed down its report, My Life, My Choice, to both Houses of Parliament. The report outlined 52 findings and made 24 recommendations in relation to end-of-life choices. Unnecessary suffering at end of life and broad community agreement regarding individual autonomy formed the basis for the committee's recommendation that the Western Australian Government draft and introduce a bill for voluntary assisted dying. The WA Government considered its response to the committee's report and instructed the Department of Health and the Department of Justice to implement the committee's recommendations relating to voluntary assisted dying, including developing legislation and forming a ministerial expert panel. The Ministerial Expert Panel on Voluntary Assisted Dying was established and commenced in December 2018. The panel was chaired by Mr. Malcolm McCusker, ACQC, and Dr. Penny Flett, AO, was Deputy Chair. The panel prepared a discussion paper and undertook widespread public and expert consultation in the development of its recommendations. There were a total of 867 participants involved in the consultation process, and a further 541 submissions received by the panel, giving a total of 1,408 consultation interactions. Participants were involved by providing their views at public forums, at stakeholder roundtables or meetings, or attendance at grassroots sessions. The submissions were received either online, by email or mail. The Ministerial Expert Panel on Voluntary Assisted Dying then made their final report. The drafting of the legislation was finalised and resulted in the Voluntary Assisted Dying Bill 2019, which was tabled in Parliament in August 2019. The bill had to then be debated and pass both Houses of Parliament. There were 70 hours of debate on the bill in the Legislative Assembly and 105 hours of debate in the Legislative Council. It was passed on the 10th of December 2019. There is now a planned implementation period underway before the full Act will be proclaimed by Parliament, which is expected in mid-2021. Once that occurs, voluntary assisted dying will be a choice available to eligible Western Australians. The Voluntary Assisted Dying Act 2019 is lengthy and detailed. This presentation is not intended to give you a full overview or understanding of every aspect of the Act. It intends to introduce you to key elements. For comprehensive details, please refer to the Act in full. This is available on the website of the Western Australian Parliament or via the Voluntary Assisted Dying webpage of the WA Department of Health. Part 1 of the Act sets out the principles and the key themes for voluntary assisted dying in Western Australia. The principles will serve as a guide in interpreting and applying the Act. They reflect the importance of giving people genuine choice and autonomy over their decision-making, while also recognising the need to protect individuals who may be vulnerable to undue influence. The principles make it clear that the intent of the Act is to respect individuals, their autonomy, decisions and beliefs, rather than imposing one person's values onto another or questioning the value of a person's life. Voluntary assisted dying is about recognising an inevitable death and giving people genuine choice about the timing and manner of their death. It is not about questioning or comparing the value of an individual's life. The principles also recognise the importance of providing people with all the potential options and information at the end of their life to enable them to make informed decisions and a genuine choice. To be eligible for voluntary assisted dying, the person must meet all of the eligibility criteria. This includes that they are aged 18 years or over, that they are an Australian citizen or permanent resident who has been ordinarily resident in Western Australia for at least 12 months. The person must have been diagnosed with at least one disease, illness or medical condition that is advanced, progressive and will cause death, and will, on the balance of probabilities, cause death within a period of 6 months or 12 months for neurodegenerative, and is causing suffering that cannot be relieved in a manner that the person considers tolerable. The person must have decision-making capacity in relation to voluntary assisted dying. They must be acting voluntarily and without coercion. They must have an enduring request for access to voluntary assisted dying. During the process, 2 medical practitioners must independently assess the person as eligible. These medical practitioners must meet certain requirements and have undergone mandatory training. They may also refer the person for additional assessments if required. The person must make 3 separate requests for voluntary assisted dying. The first request, a written declaration, and a final request. The written declaration must be witnessed by 2 people who must meet specific requirements. The person must be informed of many different aspects relating to voluntary assisted dying, as well as their treatment and palliative care options. The person can withdraw or revoke their involvement at any stage. Voluntary assisted dying may be through self-administration or practitioner administration of the voluntary assisted dying substance. This is a decision the person makes in consultation with their coordinating medical practitioner. If by self-administration, the person must appoint a contact person who has specific responsibilities, including the return of any unused substance. If by practitioner administration, this may be done by a medical practitioner or by a nurse practitioner, who again must meet specific requirements. The death certificate must not include any reference to voluntary assisted dying. A high-level summary of the process is available on the Department of Health website. The Department of Health will establish a pharmacy service that will be responsible for providing the approved substances for voluntary assisted dying. The Department of Health will also establish a care navigator service. This service will provide information related to voluntary assisted dying in WA and support patients, families and carers through the voluntary assisted dying process if required. There are other aspects of the Voluntary Assisted Dying Act to be aware of. Health practitioners are able to refuse to participate in voluntary assisted dying for any reason, including conscientious objection. Healthcare workers must not initiate discussion about or suggest voluntary assisted dying to a person to whom they are providing health or professional care services. The exception to this is for medical practitioners or nurse practitioners if, at the same time, they also inform the person about treatment and palliative care options available to them and the likely outcomes of that care and treatment. The Voluntary Assisted Dying Act requires the creation of a board that will monitor the operations of the Act, collect and maintain statistical data, conduct research and analysis, report to the Houses of Parliament on the operation of voluntary assisted dying, and provide reports, advice and recommendation on best practice or areas needing improvement to the Minister for Health and to Parliament. The State Administrative Tribunal may review certain matters, namely, whether the patient has or has not been ordinarily resident in Western Australia for a period of at least 12 months, or has or does not have decision-making capacity in relation to voluntary assisted dying, or is not acting voluntarily and without coercion. The matters which may be the subject of review by the Tribunal are limited and do not extend to each of the eligibility criteria. Most of the other criteria involve clinical decisions and are not subject to review by the Tribunal. The Act establishes a number of offences, penalties ranging from fines through to life imprisonment depending on the severity of the offence. The Act also outlines protections for those acting in accordance with the Act and in other circumstances, such as for individuals present at the time of administration or for first responders. A project is underway at the Department of Health to ensure that voluntary assisted dying is implemented properly in Western Australia. It is important to make sure the process is safe, appropriate, and follows the law. The Department of Health will be the department principally assisting in the administration of the Voluntary Assisted Dying Act and is the department responsible for implementation. Information can be accessed on the Department of Health's website for voluntary assisted dying at www.health.wa.gov.au/voluntary assisted dying. There are many important elements involved in preparing for the introduction of voluntary assisted dying in Western Australia. These elements include establishing the Voluntary Assisted Dying Board, the development of clinical guidelines and service delivery framework, the recommendation of suitable voluntary assisted dying substances for approval, the development of the pharmacy service and the Care Navigator service, the development of the mandatory participating practitioner training, developing community and health provider information, and the establishment of secure data and reporting mechanisms. There are other departments and agencies with specific functions under the Act, or that may be involved in other ways, who will also need to undertake preparations for the commencement of the Act. It is also recognised that there are other service providers, both individuals and organisations, that will need to undertake their own preparations for the commencement of voluntary assisted dying in Western Australia. For individuals, this may mean contemplating whether or not they are prepared to be involved in voluntary assisted dying, or how they will respond to a person who raises the topic with them. For organisations, it may mean preparing their own internal policies and procedures for staff and services. The Department of Health has established an implementation leadership team to provide expert advice to the department, as well as overseeing, coordinating and facilitating the work required to prepare for voluntary assisted dying in Western Australia. The implementation leadership team brings together key experts from the government and non-government sector in health service delivery, professional clinical domains, regional, cultural and other groups. The implementation leadership team has commenced its work in preparation for voluntary assisted dying to be available to eligible Western Australians at end of life in mid-2021. The Department of Health will send out updates during the time leading up to the implementation of the Act. The intention of these is to keep people informed about the progress of the project and the work of the implementation leadership team. There are many aspects to the implementation that will need the perspectives and input of different key stakeholders and at different stages of the implementation planning and development. This input will be sought by the implementation leadership team as required. There are many ways that you can keep informed about the progress of the preparations for the implementation of the Voluntary Assisted Dying Act. The Department of Health will periodically update the information on the Voluntary Assisted Dying website. You can also subscribe to email updates that will be sent out from the implementation leadership team or in relation to key events. Presentation end.